Good morning, council members. I am pleased to welcome everybody. And Mr. Chairman, thank you for agreeing to a mayor council breakfast, specifically to support or to present and discuss a budget outlook for the budget formulation that we are about to undertake. I want to recognize the City Administrator, Kevin Donahue, my Chief of Staff, Tomas Talamante, Senior Advisor, Lindsay Parker, Deputy City Administrator, Jenny Reed, and Deputy Mayor for Health and Human Services, Wayne Turnage, and the State Superintendent, Antoinette Mitchell. We are going to share updates on fiscal 27 budget process and outlook. Let me first acknowledge some wins in FY26, and I want to thank my team, my intergovernment relations team, and for all of their efforts in securing $90 million for the DC Emergency Planning and Security Fund, which will be especially important from where we've been, and looking forward to America 250 celebrations. I also am very, very pleased, after many years of trying, that $40 million for DC TAG has been secured. This is the DC Tuition Assistance Grant Program, and it includes a much-needed increase in the maximum annual award from $10,000 to $15,000. And it also increases the lifetime cap, which was $50,000 and will be $75,000. It also ensures that we won't run into an issue, the budget work that we've done, that we won't run into the issue like we did last year, where essentially capped our approved budget at the previous year's budget, disallowing almost $1 billion in spending. I want to pause for a moment on DC TAG and recognize the just amazing contributions of Congresswoman Eleanor Holmes Norton in securing those dollars, and just also remind everybody of how important those investments in public education has been for our city in growing our population and keeping families in the District of Columbia. I also want to recognize two outstanding public servants who have accepted leadership roles. I appointed Talib Shakir, where's Talib? There he is, as the director of the Mayor's Office on Returning Citizens. Director Shakir previously served as the deputy director of the Mayor's Office of Community Relations and Services, where he oversaw citywide constituent engagement. I also appointed Julian Purdy. Please welcome Julian to DC government. And he is the director of the Mayor's Office on Veterans Affairs. Director Purdy previously served in the Biden-Harris administration as the Deputy Assistant Secretary of Policy in Veterans Employment and Training at the U.S. Department of Labor. So we are very happy to invite them both to their new positions. So next, Mr. Chairman, we are ready to jump right in to the budget presentation, but I will turn it to you for any comments.
I will be pretty brief. I want to note the Council of the District of Columbia is a dynamic and ever-improving branch of the government, and I say that because I want to acknowledge our newest council member, Donnie Crawford. Yay. I want us to get right down to the presentation. As I have said to many, I'm concerned that we have challenges as you develop your proposal for the budget for next fiscal year, and I think all of us will benefit from a full and frank presentation and discussion of what those challenges are. So you noted at the beginning, Mayor, that you appreciated my willingness to have this Mayor Council breakfast. Of course we should have this Mayor Council breakfast. I was willing to have it about 10 days ago. I think it was in the middle of the snowstorm, so I get that that wouldn't work, but I'm glad that we're all here.
Fantastic. So with that, I'm going to turn it over to C.A. Donahue to begin the discussion.
Good morning, everyone. You're going to hear from a few of us, starting with me. So this is a really wonderful opportunity to be able to have discussion. We normally don't do this at this point in time. This early on, we typically have we do have the budget baton. We hand it over to you in early April, where you have the budget baton. And it's really come to our attention as we start our process in fall. We hit a crescendo in February and March that, as we talk to some of you, talk to advocates, that we may be operating in different realities in terms of what is really the basis of our FY27 formulation. If you go to the next slide, you'll see sort of three elements that really guide and direct what we are dealing with. One is that we have a fund balance that we've been able to operate on for about 5 years that is going away. This means that we have to live within our means in terms of spending according to our revenue. This has a pretty significant effect on differences between 26 and 27. Second, we have a number of activities we fund this year that simply are not in the budget next year. And third, we have lower revenue growth. So our revenue is lower than our inflation rate. So this creates a picture that's actually different. If you go to the next slide, that you see three bars. One bar is our levels for 26, which is about $12 billion of local funds. That's how much we're spending this year on activities we're doing this year. If we were to do everything this year, next year in 27, factoring in inflation, we'd have to add about $450 million to what we're doing this year. So we'd have to spend about $12.4 billion. However, our starting point is not what we're doing this year. It is what is in the council's approved budget for 27. In other words, we have a 4-year financial plan. The 4-year financial plan for 27 has resource levels or funding at $11.3 billion. So as we talk to folks, we would talk about what new can we do? How can we protect the budget we have? Our starting point is not what we're spending this year. Our starting point is the approved council budget for the district for 27. That's $11.3 billion. So as it stands, just in numerical value, our starting point is $700 million less than what we're spending this year. If you factor in purchasing power, the cost of inflation, where you add that $450 million to what we're spending this year to be able to continue doing our work next year, the difference between what is in our budget, which is our starting point for formulation for 27, and the cost of carrying forward what we're doing this year is not just a $700 million delta, it's about a $1.1 billion delta. In other words, I'll say this sort of once again, to be able to continue doing what we're doing this year, next year, would require us to be able to increase revenue by $1.1 billion. That is not the world in which we live in. So part of the value of these three bars that sort of try to make it stark is that this is a really hard budget. When we talk with advocates, some of you, the premise is always what more can we do? Our starting point is how do we begin to buy back, either through cuts or through revenue that we might get at the end of February? We don't know. Some of the reductions that are already in the existing financial plan. That's sort of the starting point for us in the budget. I've worked in district government for the most part for the past 25 years. I did budgets during the recession. This is as hard as anything that we did in the recession. Because our starting point typically is framed when people think we have a hard budget in a drop in revenue. So they'll hear about a revenue forecast that went down. Because what makes this hard is actually the starting point for formulation, which is what resources do we already have in our financial plan, is so much lower. The difficulty of this is sometimes camouflaged behind the veneer of seeing flat or slightly modestly increasing revenue growth. If you were to factor in even the September revenue estimate, it is only about $9.6 million of net new revenue for FY27. If Congress overturns the emergency law that was passed, we'd just be looking at about $148 million of total new revenue over the course of the 4 years. And that is sort of a comparison to, again, this $1.1 billion delta between the cost of doing what we're doing this year, next year, and a $700 million gap between the resources available this year compared to the resources available next year.
Kevin, I think it would be helpful if you talked through the bar graph, literally explaining the variations in the bar.
So the first bar graph you see in FY26, that totals to $12 billion, which are our local or general fund budget. There's a solid green part, which is the recurring levels, and then sort of this lighter green part above that, which is limited time, limited resources. So in other words, one-time resources that exist this year, but not in next year's financial plan. So the difference between those two is you see that on a recurring basis, we have substantially less revenue carrying forward over all 4 years of our plan than we have this year. But $12 billion is how much we will expend this year on government services and activities. The middle bar, you see it going up. Now, it's going up by, if I were to put a value on it, about $450 million. That total bar, the green, the light green, the sort of that purpley blue above it, that would be the cost of carrying out everything we're doing this year, next year. In other words, we're not doing anything new. We're simply doing what we're doing this year, next year, accounting for inflation and must funds that we have to fund. That would require us setting aside about $12.4 billion. So it goes up. The cost of carrying out any service goes up. So you see the middle bar goes up. And that's supposed to represent about the $12.4 billion that would be needed to do everything we're doing this year, next year, doing nothing new. The final green bar is what is actually in the approved financial plan budget for FY27. When the council finalizes the budget, it's always a 4-year financial plan. The details of the out years are typically don't get as much attention as the details of the budget we're passing for that coming year. Because typically there's not a lot of variation between the budget you're putting together for that upcoming year and what might be in the out years. In this one, there's significant variation. So that final bar represents $11.3 billion, which is the amount of money and funding that was in the FY27 financial plan for the budget that was passed by the council this past summer. That's why I say our starting point is not what we're doing this year. Our starting point is how much resources do we have available in next year's budget to start with. And that is $700 million less than we have this year, and about $1.1 billion less than what would be needed, factoring in for inflation, the cost of carrying forward this year's services. So that third bar is really our starting point. There's a small amount of what you see, that lighter green bar gets a lot smaller. So there's still some fund balance that we're carrying forward in the plan, about $286 million of fund balance from prior years that we're carrying forward. And we effectively do not rely upon any fund balance by the end of the 4-year financial plan. So that third bar, though, is the key. So when we talk to advocates, talk to some of you, the number you often naturally have in mind is what our budget is this year. We see a September revenue estimate that has modest growth. And there's an assumption that there's more resources available. And that's where I said the lens with which we look at this upcoming budget is different, and the purpose of this breakfast is to try to unify them some, because our starting point is that third bar, which is $11.3 billion. That is what we have as resources available to us. But I want to go into some details. So when we put a financial plan together, we don't carry forward generalized reductions. The CFO requires us to make specific itemized reductions so they know if we have to live with that budget exactly how we do it and is it financially sustainable. So Director Reed's going to walk through 2 slides. One will be what services that we're funding this year that are not in next year's financial plan. In other words, we would have to either cut services elsewhere or find new revenue to be able to fund those items. And the second slide that she'll present speaks to where are we seeing the greatest inflation. And then Deputy Mayor Turnage and Superintendent Mitchell will go into 2 specifically challenging areas, one with healthcare and one with early childhood. Director Reed.
Thank you, City Administrator. Good morning, Council members. So this is not an exhaustive list of all of the one-times or cuts, but it's illustrative of some of the challenges that we're going to be facing as we put together the FY27 budget, as you heard the city administrator speak about, and areas where we're really looking at how can we buy back some of these items. So reductions in the financial plan, this means there's a cut beginning in FY27, 28, or 29. That's part of the way the approved and balanced budget and financial plan was passed. So for example, there's movement of fixed costs out of DCPS and into DGS. That has the resulting effect of lowering the costs and the expenses that go into charter schools. Pay equity is eliminated in FY27. There are further restrictions to the Alliance program in 27. There are sanctions to temporary assistance for needy families that rise to 30% for those that have been on longer than 60 months. And then there are reductions to programs like Pathways, Violence Intervention, Family Success Centers, Emergency Rental Assistance, the Home Purchase Assistance Program, and other programs, right? All programs that we know we care a lot about, and we look forward to trying to buy back. In addition, there are items that are only funded as one time, meaning they're just funded in FY26, and they don't have recurring dollars behind them into 27, 28, and 29. One example of that is overtime. As you all know, we've had to respond to a lot of more calls for service. Our overtime costs have increased. That is going to be something that we're going to need to figure out how to budget for in FY27. Our clean corridors and composting programs are funded as one time. Direct support professional wages, supporting those that help work with individuals with healthcare needs in their homes, is funded one time. Some portions of our costs for our continuum of care for our homeless services, our out-of-school time programs, our response for victims of sexual assault, janitorial, and grounds maintenance are funded one time. The parent stipend program, which I know our superintendent and our OSSI DOT department has been utilizing to help make sure we can provide parents the options to transport their kids to school in the best way they see fit. Our heirs legal property assistance program, and our portion to get to our $100 million of the Housing Production Trust Fund. So again, this is not a complete list of everything that is sort of funded on a one-time or has cuts in the out years, but it does give you a flavor sort of for the variety of things that we will need to be focused on buying back. Before I turn it over to Deputy Mayor Turnage, I did want to explain, as the city administrator mentioned, some of the inflationary pressures that we're facing just on doing the things that we do every day. So we know that costs go up to provide everyday services, and this gives you some examples of some of those items. So we expect to have to add about $175 million in new spending just to fully fund overtime across many of our key public safety agencies. We expect our WMATA subsidy to increase by about $24 million just with the year-over-year growth. Our pensions, our utilities, our leases, our fixed costs are growing by about $43 million. The Deputy Mayor will go into more details, but absent any policy changes, our Medicaid costs would increase by $297 million. And the superintendent will go into more details on this, but I know that you all have discussed, we're seeing higher enrollment and utilization in our child care subsidy program. And right now in this fiscal year, that program is facing a pressure, and that will continue into FY27 absent any changes. It's important to note that of all these expenditures I just went through, right now we're only looking at about $10 million in new revenue in 27 to support this. So as the CA alluded to, we are going to have a really difficult set of choices that we are going to have to make as we put together this budget. And so with that, I'll turn it over to Deputy Mayor Turnage to walk you through some more details on some of the Medicaid challenges.
Good morning, council members. Oh, I'm sorry. Good morning, council members. Before you are a few slides on the Medicaid and the Alliance program, which outline the existing funding challenges while detailing the very significant savings initiatives that were put in place in 26 and are being contemplated for 27. And these changes will echo through the financial plan if they're executed. If you look at slide 7, you will see that changes to the Alliance and the Medicaid programs in fiscal year 26 and 27 respectively, generate savings totaling $245 million and $176.3 million, respectively. How do we get there? For Alliance, we created these savings through eligibility reductions in both years, plus a moratorium on enrollments for adults over the age of 26. And we narrowed the program benefits while creating a change in program structure. In other words, we took the Alliance program, which was in managed care, and we moved it out of managed care to a fee-for-service program. So what we avoid by doing that is paying the health plans a monthly capitated payment rate for, in many cases, for members in the Alliance who may not have been accessing services. So you avoid that cost, but you do lose the benefit of having their care managed. For Medicaid, the 2-year savings are $176 million, are generated mostly by the eligibility reductions to 138% of federal poverty level. If you look at federal poverty levels at 138%, that's about $21,000, about $21,500 annually. For a family of 4, that's about $44,000, a little over $300 annually. We reduced that level from 205% of federal poverty for the 26 budget. We also have some Medicaid changes that generate savings on the health plans. We basically require them to hit what we call targeted program efficiencies, and we normally take that money out if they make the efficiency. What we did this time is tell them we want you to hit $5 million in efficiencies, and we took the money out at the beginning of the fiscal year. So if they don't hit it, then it hits their bottom line. If you turn to the next slide, slide 8, this gives you some sense of the impact of the change in the Alliance policies. As you can see, we have seen significant reductions in Alliance enrollment, which are projected following the last quarter of fiscal year 25. If you notice that beginning in quarter 1 of 2026, we predicted enrollment declines from roughly 27,600 to roughly 25,000 in the first quarter of this fiscal year. We checked the data last week on the actual figures for the Q1 of fiscal year 26, and that's still a rollout that could raise these numbers, but the decline was steeper than we predicted. It's down to roughly 19,000 members as of the first quarter of 2026. Now, there are 2 possible reasons. One is clearly the eligibility reductions and enrollment moratorium that we have in place. The other is that we're seeing a pretty significant drop in the number of Alliance members who are recertifying. These are members who are already on the program, and when we came out of the pandemic, we allowed them to recertify passively. What that means is they had to do nothing. And the challenge with that is we don't have a Social Security number for most of them, so we can't keep that policy in forever. So we got rid of the policy that said you could recertify passively, but now you have to do it actively, which means you can go to the website and recertify. We're seeing a pretty sharp drop in the number of people who are doing that. And we think this is probably a chilling effect of the ICE activity leading to stepped-up deportations. But with the change in Alliance eligibility levels that is scheduled to take effect October 1, we could see eligibility for Alliance drop to around 12,000 members. Next slide. We frequently get asked, well, why don't you put all this stuff back? Why don't you take Medicaid back to where it was and take Alliance back to where it was? What would it cost to reverse all of these changes? This table shows you that if we reverse these changes, and the CFO predicted that enrollment levels would return to what they were before we executed the changes, that it would cost almost $300 million a year to put everything back in place, which over the financial plan is almost $1 billion. So you can see it would be very expensive. One of the things that we do at DHCF is try to get a sense for how much growth we are seeing in the program for Alliance and Medicaid And we do that by taking the prior year's budget, and then we ask the question, if we were to execute these policies in the coming fiscal year that were in place in the prior year, how much change would we see in terms of cost? Well, I looked at a period from fiscal year 24 to fiscal year 27, calculated the difference between the prior year's budget and the projected need, and then took the average, which it came to about $141 million of local funding. If you extrapolate that across the financial plan, that's roughly $566 million for the financial plan that if you funded the growth in Medicaid. So what's driving this growth? If you turn to slide 11, even with the eligibility reductions that we made, and I would say when you think about those reductions, those members were not removed from coverage. We moved them to a basic health plan, which is a fully federally funded program run by the exchange, and those members were automatically enrolled in that coverage once they lost their Medicaid. But even when you consider that we reduced the eligibility levels for Medicaid in the fiscal year 26 budget, if you look at this table, the district, which is represented by the red bar, for virtually every category of eligibility, exceeds the federal minimum requirements for all major eligibility groups. The only place where we do not exceed what is typically done is on the expansion program. And again, the federal government doesn't require you to do expansion, but if you do it, you have to fund eligibility levels at 138% of poverty. We do that. Federal government says you don't have to do it at all, but you do it and you get a 90% federal match. So what does that look like in terms of service? What that means is, with those aggressive eligibility levels, when you look at the data, we are basically providing health care coverage for 4 in 10 D.C. residents, about 41%. And then when you factor in the alliance, it's a slight bump, but roughly 41% of D.C. residents are getting publicly subsidized health insurance from DHCF through the Medicaid and Alliance programs. So if you turn to the next slide, one of the issues that was raised with the council contingency list was a restoration of benefits for Alliance residents who lost their dental, some private duty nursing. There's a list of those benefits that are no longer covered in Alliance in fiscal year 26. The council asked DHCF and directed DHCF to fund those benefits for the remainder of the fiscal year. In our research, we quickly determined that if we did that, we would be providing a benefit in Alliance that the members who were moved to the basic health plan from Medicaid did not have. And so the question is, do we move forward with that inequity? And there are, a number of options. One is we could, and Jenny would support this, is parking that money and using it to address some of the challenges that we have coming in 27. We could go forward with the eight-month benefit, but then you turn it off right after September. Or you could try to pursue equity with the Alliance program and the people in the basic health plan who used to be in Medicaid. But that will obviously cost you more money. Finally, I wanted to give you a sense for the challenge that faces the council that is already in the financial plan. For Alliance, in fiscal year 28, coverage is eliminated for all adults. That's about, we estimated 24,000 people. That number could be less based on the data that we've seen. But the savings in the financial plan for this cut is $125.9 million. For Medicaid, coverage is eliminated for all childless adults. This is the Obama expansion population. There's 93,000 roughly persons who are benefiting from the Obama Medicaid expansion. It's a 90% federal match. We only pay 10%, but it's a very expensive program. It costs the city, the total cost of the program is almost $1 billion for 93,000 people. Our share is about $100 million. We calculated a $77.3 million savings. So for those two reductions, there are roughly over $200 million in cuts that if the council decided or if the mayor decided they wanted to revisit those cuts, we'd have to find over $200 million. And that is, I think, all that I have.
And then we'll hear briefly from Superintendent Mitchell about the second topical areas of the child care subsidy.
Good morning, everyone. The Child Care Subsidy Program provides support to eligible families for child care payments. There are currently about 7,380 children in this program, about 294 providers, and that is roughly 63% of all providers in Washington, D.C. Families have to meet eligibility requirements in order to enroll, and most of the families are working families, families that are looking for employment, TANF and SNAP, and then vulnerable children and children under protective services. OSSI makes monthly payments directly to participating facilities, and the budget comes from local, federal, and MOU with DHS. So we're here today to talk about some financial pressures that we are facing based on several things that came together at the same time. First of all, we've had a growing enrollment in 2025. We saw a 29% increase in the number of children who are in this program. We also have growing costs because high-quality facilities have come into existence. We do an annual review of the facilities for quality, and we saw a tremendous increase in the number of facilities that are now high quality. And then finally, we've experienced some budget reductions. As a result of all of those reductions, as you can see, we are facing a multi-million-dollar deficit in this program. Next slide, please. In order to address this deficit, which is $32 million if we were to continue going as we are going right now with the number of students, but because we don't have any controls on the program, without some new policy, the deficit could go all the way up to $42 million. So we've come up with three potential notions that could reduce this gap in funding to some degree. The first recommendation is to pay all providers the same lower rate rather than paying three different rates. Right now, we have a basic rate. If the quality is a little bit higher, it's 2% higher, and then the highest rating is 8% higher than the base. Another way that we could reduce this deficit is to implement a wait list. Other states have implemented a wait list given that the eligible children often outnumber the amount of money that we have to run the program. The wait list, right now, OSSI enrolls all eligible families. The wait list would enable us to cap enrollment. And then once the number of students matriculate out, then we could open the wait list up in an order of priority. Now, we would anticipate that the wait list would be in effect, and we would not be able to increase or open up enrollment for about a year. A third idea is just additional changes to program that would enable us to, one, lower the rates for school-age care on DCPS days that DCPS is closed, and to more rapidly terminate services for non-attending children. It's really important that we make some change because time is working against us. The longer we don't make changes, the less benefit we will receive in terms of reducing this deficit. And then in addition to that, unless we put in place a wait list, the number of children will continuously increase, and then the budget will not be able to meet those needs.
Thank you. And I'll just sort of close by saying that we picked these two areas very intentionally. They are not the only areas of difficult challenge that we have as we formulate the budget, that you have as you do oversight once you have the budget. Healthcare is an area just by virtue of its sheer size that a 2 or 3% inflationary pressure in healthcare, because the base spending is so high, translates to sometimes a $10 or $100 million spending pressure. And then we identified child care subsidies. One is because it did come up when we had a hearing on spending pressures. And two, it's illustrative of the type of budget discussion we're having now, which is not necessarily how do we do more, but how do we smartly navigate an environment in which we have fewer resources to be able to put forward to really good programs. And with that, I'll close out.
Okay, Mr. Chairman, I think that's what we plan to present.
I'm sorry, where are we?
We're finished. Our presentation.
All right, thank you. Let me take questions from council members. I'm going to start with Councilmember Nadeau.
We'll try this. Thank you, Chairman, and thank you all for the presentation today. I appreciate all the additional information about the budget pressures. One of the conversations that we've been having in oversight is around the funding of Alliance and the money that council put into the contingency. What is the updated cost estimate for restoring Alliance service coverage for the remainder of FY26 with enrollment down so low and now us being halfway through the year? It originally was $21 million for all of FY26 with much higher enrollment.
Yeah, the dollars that were directed through by the council are sufficient to pay for all of the benefits that we eliminated in fiscal year 26. And with the decline in enrollment, there'll probably be some leftover funding from that $21 million. I don't have the precise number, but again, as you recall, the Alliance population has dropped about 4,000 members more than we anticipated at this point in time.
Thank you for that. Very helpful. Would the remaining amount be enough to ensure dental, vision, and long-term care coverage to anyone on a basic health plan who meets the Medicaid eligibility rules?
Yeah, the basic health plan, if you factored in vision and dental, the total cost for vision and dental for the basic health plan would be about $5.7 million. We'd have to do the math to figure out if the surplus that's created by the decline in Alliance enrollment is sufficient to pay for the Alliance benefits that were eliminated, plus provide the basic health plan with almost $6 million. We'd have to do that math.
Okay. Thank you very much for that. One question I have is regarding the balance of the additional revenue. So the September 2025 revenue estimate showed an additional $110 million compared to the June estimate. The contingency list accounted for about $51.5 million. Is the other 60 available to address the shortages in the child care subsidy?
Councilmember, I think I'm going to ask our CFO to weigh in, but I believe that all of the 25 revenue has been accounted for as part of the year-end close, and I know we have our ACFR hearing where we'll be discussing that later today, but I'd ask the CFO to confirm that, please.
We do have our ACFR hearing today, so we'll be able to describe our ending position and attempt to answer your question there.
Sorry, I'll just clarify. Those were the 2025 revenue estimates, but it's 2020 FY26 funds that I was asking about.
All right, so you're speaking of the September revenue estimate, Councilmember?
Yes. So the council directed $51.5 million of it, but that should leave $60 million. Where are those funds going?
So the council directed some of $41 million of year-end FY25 funding, and then there was appropriation authority allowing it to be spent in FY26. New FY26 revenues are dependent on both the February estimate that we'll get at the end of the month, as well as any movement on the decoupling bill.
Okay. I'm sure there are others with questions, but I'll just do one more. And I guess, why is the child care subsidy program the only program being so deeply scrutinized for overspending as opposed to any other program in our budget?
Every program gets a equal rigorous screening. We presented it here because it was a program that came up a number of times at the oversight hearing that we had on overspending, one. And two, it is a pressure that we know is growing if we don't make changes during this fiscal year.
Thank you.
But it's illustrative of the kind of scrutiny we're providing virtually every program in which we're seeing high cost growth.
Are any of them outside the Health and Human Services cluster? Because that seemed to be the bulk of the presentation today.
Yes, the Health and Human Services cluster represent healthcare, human services, represent a substantial portion of the budget. So it is, along with schools, so those three combine for probably nearly 60% of our budget. So the size of healthcare alone has implications on the rest of the budget, given the dollar value of even modest increases in cost growth.
Thank you, Chairman.
Thank you, Councilmember. Councilmember Freeman?
Thank you very much. The way I'm understanding the numbers, so the September revenue estimate was $11,020 million, and the rollover dollars that are still coming in are around 288. So that gets you to about 1.3 billion plus and 10 million. So I'm thinking that's where your 1.3 million benchmark comes in, and that's where the 9.6 that's available. Is that right?
The bottom line is if the congressional action associated with our decoupling legislation moves forward, the revenue forecast in September offset the losses from the OB3A.
I get it.
And
I get it. I have the revenue estimate in front of me. I'm just trying to pin down where the 11.3 comes from, and that's where it comes from.
yes, and remember that what you're looking at is the revenue forecast. In addition, we're depending upon fund balance, accumulated fund balance, to support spending in fiscal year 27.
Actually, that's what I said.
Yes.
The billion 220 plus
And the specific
280.
numbers,
Yes, so
Don't have.
it builds in that we lose on decoupling. If we succeeded on decoupling, that would add 150 million.
more resources that are unaccounted
Okay,
for.
great. So that's one thing, and we'll see how that plays through. You looked into the child care subsidy and you did an analysis of that, but there is, on, I don't know, one of the early pages, pay equity eliminated. That's a big change. And
Council member, that's what you voted on last year.
so it stays out into what you're building out.
No, I haven't said what we're building out, but that's the present state.
Okay. So in order to restore, if there's just a little bit of money left over and we wanted to restore things on here, that's going to have to find its way into the 9.6 million or some other kind of cut or revenue raiser to get pay equity back on the table. And is it your intention not to include pay equity, to try to include it or not to include it?
Oh, I haven't said anything about my intentions. What we're talking about is what the approved budget was last year. And obviously, you know what it would take to get back those things, more revenue or a change in how we spend in other places.
Okay, last thing, when do you expect school budgets to be released to schools? Is that in February this year?
Yes, it is.
Yes,
Yes.
we expect it to be in February. We don't have an exact date for you right now.
Okay, thank you.
So let me reiterate, the purpose here is to discuss the pressures on the formulation of the budget, not to out the mayor and what her decisions are, because you haven't gotten that far.
That's correct.
And The difference between ECE, which is pay equity, and childcare is ECE in the financial plan was zeroed out. And if you remember, I think it's slide 3, well, it's actually what's up there. There's some one-time stuff, and that would be ECE. And then there's stuff that has been under budgeted, and that would be the childcare subsidy. So we can't really have a discussion of how to cover under budgeting of ECE because it's not budgeted at all. Well, we can have a discussion of under budgeting the child care subsidy because it is under budgeted. That's the difference. I look at this as going back to the first couple of slides and discussing what is funded one time, that is in the financial plan is not funded at all, and stuff that has been underfunded in the financial plan. And in my view, all of that is on the table in terms of, to use the city administrator's language, what the executive can buy back in their budget formulation. I hope that's helpful. And next on the list is Councilmember Pinto.
Well, thank you, Mayor and thank you very much, Mayor and team. This is obviously not a fun conversation or budget year, but I think really important that we're having it early so we can be going off of the same set of information and hopefully not doing things throughout the next 4 months on a piecemeal basis, but zooming out and ensuring we're getting back to basics of what we have to fund as a government to fulfill our obligations to our residents around safety and education and needs and healthcare. I have a question about, I don't know if we're calling these proposals or more just an outlook, but when we look at some of the adult populations that would be not included in coverage for Alliance or for the childless adults for Medicaid and the cost savings that would immediately result, have we modeled out any of the cost pressures that would be a part of that to our healthcare system more broadly or to our hospitals or uptick in people visiting the emergency room without coverage?
You know, we always, when we deliberate on these things internally, we always talk about we call it the Medicaid balloon. You squeeze it in one place, it pops out somewhere else. But from a standpoint of estimating savings, the CFO is not going to allow us to say, well, you know, if we do this, it would cost, we would save $100 million, but we think that more folks would go to the emergency room, so that $100 million in savings would probably only be $20 million. They don't allow us to do that because it's speculative, even under the best of circumstances. So we can't. We think about it and we try to put policies in place, even given the reductions, that would mitigate those possibilities, but we cannot. We can't reduce the savings amount by an expectation that something is going to happen that creates a cost pressure when we do it.
Councilmember, might I just add, I want to acknowledge Wayne and his team and Mila Kaufman and his team and her team. I just want to call out that the changes that were recommended last year to these healthcare programs, they were dramatic, and they resulted in dramatic cost savings. And they also resulted in people being moved to other plans where they can achieve health care. So I just want I would ask the council to go into these discussions, not assuming that any change is something bad. These changes are going to make these programs more sustainable for more people for a longer period of time. And we should just use this year as an example that we were able to achieve savings, cost savings, efficiencies, and people maintain coverage.
Councilmember Felder.
Hello. Thank you, Mr. Chairman. Thank you, Mayor and members of your team for this very helpful presentation. It definitely looks like we have some challenging decisions to make. Nonetheless, Mrs. City Administrator, maybe you can answer this question. Could you speak to what the executive is doing to identify opportunities to reduce waste, such as duplicative services and/or programs and services that may not have the intended impact?
There's two major efforts that we do that I think will come about. You'll be able to go into more detail when obviously you're to have the budget and doing oversight. One is that we ask each director to hit sort of a budget target that assumes a certain level of reduction. And very much, I believe that those who are closest to the operational issues will often have the most nuanced, effective ideas for navigating safely difficult fiscal times. We had some outstanding budget recommendations move forward to us. By recommendations, I mean how to appropriately navigate reductions in spending between 26 and 27 while trying to minimize the impact on the ability of each agency to do its mission.
Okay.
So each director came forward with hitting a budget target, and much of what we'll ultimately incorporate comes from folks doing the work. Second area is there are some issues that cut across a lot of agencies. So over the summer, we had a number of working groups run out of my office that involved folks at agencies, folks within my office, that took on areas where we had cross-cutting cost pressures. So they would look at the competitiveness of a contracting process. They look at employee benefits. They look at energy utilization across government. They look at overtime spending. So areas where we have common issues, we would have a way of bringing in a working group, the agencies together, doing analysis about what was ultimately driving those cost pressures, and they put forward recommendations to us, much of which we were incorporating into our formulation, the areas where we see duplication or opportunities that cut across different agencies to be able to drive down cost growth. However, I want to sort of caution folks is that the size of the gap that we have, even if we have optimally run operations, is often not enough to be able to hit the budget target without having difficult decisions about core mission work. So just reducing duplication and efficiency, typically, given what you see on this slide, is not enough in and of itself. We do have to look at how we make adjustments to core programmatic work. Thank you.
Thank you, Councilmember. Councilmember Tran White.
Thank you, Chairman. I want to thank you, Mayor Bowser, and your team. I guess for me, there are many concerns, but one of the concerns I have is around the Medicaid alliance cuts. I think that we know that this reaches some of the most vulnerable populations, and it seems like we are intentionally creating barriers to get people off for the sake of saving money, and I just believe that this should be a non-negotiable because I don't know if you are automatically enrolled in services and somehow the government switches the qualifications to re-enroll, how that communicated to people, what's the outreach, engagement, education around that. And then we have a number of literacy barriers, also access to digital, access to computers, which also creates a barrier. And it seems, I know we argue back and forth about the federal government issues with our healthcare system, but it seems to me we are creating barriers within our local government for those most vulnerable populations. And I just want to caution against it. I think you said it will cost us about $300 million to keep it the same. Just trying to figure out if we explore other options instead of creating barriers to get people off, instead of getting more people on and creating more, being more creative about how we keep people on and keep people access to health care.
I'm going to ask Wayne to talk about how people were seamlessly transferred to a new program, but I just want to point to the slide that showed how many people in DC are connected to one of our programs. That sheer number would suggest that people are finding their way to connection. We were very concerned, and at first when we introduced with Wayne and Mila's work on this, we weren't sure that we would be able to do it automatically and that people would re-enroll, and that was a big concern that people would be dropped. But then they figured it out, and people were automatically re-enrolled from the Medicaid program to the Healthcare Alliance. I mean, to the basic
There
health.
were some gaps you noted that some people did not re-enroll.
Well, those are two separate issues. The mayor's right on the transfer of people from Medicaid to the basic health plan. It was as seamless as it could be. we basically identified to the person the numbers who were in Medicaid who would lose coverage, and we built a file of those individuals and all of their identifying information, and we handed that information to the exchange, and they automatically enrolled them in the basic health plan. For the Alliance, what you are referencing is prior to the pandemic, there was a pretty robust enrollment process, and at one point it included face-to-face enrollments. We got rid of face-to-face enrollments. We created a web portal. You could do it by phone. But then during the pandemic, we basically said, hey, if we will passively renew everybody who's in the program. CMS sent guidance for Medicaid that we employed for the Alliance, and that is don't disenroll anybody because it's the pandemic. Well, you can't keep that policy forever because CMS, on the Medicaid side, they unwind that and say, now you got to start disenrolling people who are no longer eligible. So what we did in the Alliance case, we said we allowed you to passively enroll, which means you didn't have to do anything. We re-enrolled you. Now that the pandemic is over and we are going through recertifications, you have to go back to the original process. And for those who are recertifying, that means they have 4 or 5 different ways you can re-enroll. So we didn't build any barriers. We just went back to the process the way it existed, minus the requirement that you come face-to-face. We got rid of that.
And more than that, Wayne, I think that we have an obligation to our taxpayers to demonstrate that we're covering DC residents. And in this process, you know, I dare say we were providing coverage for a lot of the region, in some cases, the eastern seaboard. And we have to be sure that we're covering our residents.
Thank you, Councilmember. Councilmember Allen?
Thank you, Phil. Thank you, Madam Mayor, and to the team for this. It's sober, but I also really appreciate the way you're presenting this, the deliberative part of this, hearing you lay out the problems you're identifying and potential solutions. I think these are very constructive types of conversations, and so I really appreciate that, and I'm glad we're having the opportunity. I think it's important for the public to see it that way as well. I had a couple of quick clarifying questions, Deputy Mayor, to make sure I understood one part of your presentation. On page 5, you talked about, for example, our Medicaid costs. Absent any policy changes, our costs are going to increase $297 million. And then on page 7, when you talk through FY26 and FY27 savings, this is what I thought I heard this. So if I add my 80 and my 96, 176 million in savings with these policy changes. Is the increase, so I'm flipping back to page 5.
Okay.
My increase of 297 million inclusive of those policy changes on page 7? Sorry that I'm flipping between those two, but that's what I was trying to track between those two pages.
Sure. I think the best slide to look at is slide 9, and that sort of shows if we did not make any of the policy changes that we had previously made, plus any upcoming ones, we would need to add $300 million. And then the deputy mayor was also referencing what are the savings currently built in. So they're kind of two different snapshots of the problem.
But Jenny, just to be clear, the council approved changes that are in place now are represented where?
Those, I believe, are represented on slide 7. That's
Okay.
the current state of
But
affairs.
on your chart that you just showed, the page 9 chart.
On page 9, this is showing what it would take if we rolled everything back that had previously
Got
been
it.
passed.
Correct.
Got it.
Right. And then
If you roll back what's the status quo is today, if you go back to last year.
correct. And so the number, the 297 or the ballpark 300 million, that would be just what our costs of Medicaid, just the cost of Medicaid continues to rise. And so that's what those services are, absent any other changes.
Absent, if we roll back the changes that were previously made and then accounted for like inflationary growth, that would be the roughly 300 million. We're currently working with the deputy mayor on what are the cost increases with the policies in place, because those numbers are still moving. But there will be an increase because we know that healthcare costs rise every year.
Completely agree there's going to be an increase, just trying to wrap my head around what it is. All right, second clarifying question I was trying to get to, and Councilman Nadeau had kind of asked this, but I didn't quite hear the answer, and that was, since the enrollment numbers have decreased lower than anticipated, and we're at whatever, we're about a third of the way through the fiscal year, the dollars from the contingency to restore alliance benefits, logically, that dollar amount would not be necessary. I think you said there'd be some amount of balance. Have we been able to actually pinpoint what we estimate yet to?
No, we're going to do a
dollar?
reforecast to help the budget formulation process for 27. Now that we have a pretty good indication that the enrollment levels are going down, there is a little risk to a reforecast. The challenge with a reforecast is, Councilmember Middleton used to call me all the time and say, can you reforecast Medicaid? I said, well, if you do it, you got to realize you have to live with the results. If we reforecast it and the numbers go up, then the CFO is going to make us put that in the budget. If we reforecast it and the number goes down, then we can give the money to the mayor for her formulation, then it will roll to the council. So we're pretty certain that we can do a reforecast on Alliance and it will go down, and that will show how much money is available in the current fiscal year for Alliance that is above what we thought. And then the question becomes, do you park that money for the problems that are coming in 27, or do you use it to give the funded 8-month benefit and try to pursue some equity in the basic health plan?
Yeah, no, I thought you laid out
Yeah.
different scenarios in a very helpful way.
Yeah.
Other piece, we didn't talk much about this, but it's certainly having an impact, I think, on our budget, and that is our response to the storm and overtime costs and everything else. I mean, again, I know, and I know we communicated over the weekend, the sheer amount of constituents I have in my inbox and calling regarding the responses they still need for trash collection and everything else. I know the men and women of the government and the agencies are working hard, pulling long shifts, but it has a huge cost. From the standpoint of what this storm is impacting the city from a budgetary perspective, how is that impacting both either our projected fund balance or contingency? How much is that drawing down and putting even more fiscal pressures as you look at what's the available dollars as you move into budget formulation, or are those two totally separate and you're not as concerned around that?
I regard them separately. We have and this is why we have contingency funds and emergency funds to deal with emergencies that are not part of an expected storm response. So I do regard them separately, but they will collide at some point, Kevin.
They do all, this is,
They're going to collide.
thank you for the question. They do all collide when it comes to a certain number that we have to balance against. Obviously, we did not have funding be an operational constraint in planning for or responding to the snowstorm, because we know we have ample contingency sources. That has to get paid back. That sort of is similar to the context of, honestly, the contingent spend list, which is knowing we're going into 27, $700 million fewer resources. It's funding that we would expend this year that we would just not have available to apply to 27. So we did not bind ourselves in the snow response from the budget, forecast that we're giving you. When we do formulation, ultimately we have a single number we have to be able to hit, and part of that's repaying back contingency.
Got it. Okay. And last question. Again, I think you and your team helping lay out problems and then a couple of different possibilities is a very helpful way to have the conversation. Is your intention or is your goal to have a conversation and put forward a supplemental budget mid-year? What are you looking for in terms of the fiscal year that we're in right now from the council? Are you looking to propose a supplemental budget? We're not quite sure
I
yet.
don't
Just more where the
know that
conversation
it would
goes.
be separate from where we are right now, the way we normally do it. When we propose the upcoming budget, we'll propose a supplemental either at the same time or closely aligned to that.
Okay. I thought I had heard some questions around what to do with part of the 26 contingency spending.
Yes. I don't think that we have to move a supplemental today to answer that question.
Not today, for sure.
Yeah.
Just trying to make sure I understood kind of where you want to see the conversation going.
Right.
Okay.
I think that, I hope that it's clear that, all of these things are worthy, and there are many constituents who want each thing that has been presented, but they're also all not possible at the same time. And so I think we just have some decisions to make.
Okay. Thank you very much. Thank you, Mr. Chair.
Thank you, Councilmember. Councilmember Henderson.
Thank you, Mayor and your team. I think I've had longer time to process some of these slides than most of my colleagues because Director Turnage presented this at our hearing a couple of weeks ago. And we had a conversation with Dr. Mitchell about some of the challenges in terms of child care subsidies. I think, though, I'm not entirely sure what we had hoped to get out of this conversation, but here's some questions I have. So in terms of the contingency list, what I hear, and I don't know if colleagues gathered from what Wayne was trying to say, is that in the past, our Alliance and our Medicaid programs have had parity. And if we go forward with the contingency as currently written, we will no longer have parity. We will be advancing some services for Alliance beneficiaries that we do not currently offer for those who are on the basic health plan, primarily dental, hearing aids, and a couple of other things. And so I was hoping that we could have a conversation about how do we want to proceed, because while, yes, we can wait until the budget, I don't know when we're going to get there. And it's February, and I do know that there are some constituents who either have dental surgeries that were pending, have some dental issues that are going, would like to get a new hearing aid if they can, and some otherwise. And so I'm wondering, is there a decision point, or, Mayor, what you are looking for and before you guys make a decision about how to proceed?
Sure. So I think you're asking the right questions, and I think personally, we advanced a package that last year, and you approved it, that we think puts these programs on a sustainable path. You did. And then you said, well, we don't really want that for Alliance, so we're going to change it. I believe, like I believed last year, that the current changes put us on a more sustainable path, and that's likely what I would advance again. So we're kind of giving the providers, the beneficiaries, whiplash. And I think we're setting up a plan. Is nothing stopping people from the basic health plan from then saying, oh, this Alliance plan looks better, I better switch to that. So I just think that you were setting up some unintended consequences. We made some very well-informed, difficult decisions last year around this, and they're turning out pretty well in terms of how these programs are operating. So I would invite you to stick with them. At the same time, and it was asked earlier, the council member is no longer here, why are we talking about these two things? Mm-hmm. It turns out, like, we could solve the child care pressure with the contingency list, with what you all have on the contingency list. You commented on that a long time ago, many months ago, and we want to present you with different information now about if you had it to redo that contingency list today, would you have the same list? I don't know. I just wouldn't proceed that way, to upending a program that we just changed, to change it back so it can get changed again in October. Like, that doesn't make any sense to me.
I hear you on that, and I certainly don't want to put beneficiaries through the back and forth.
Yeah.
But there were some other contingencies that we were hoping for. So, for instance, if Congress had provided the tax credit extensions under the ACA, we would have been able to provide dental for the basic health plan enrollees. And so that wouldn't even be a conversation, because that would have taken care of it. We would have had enough money to be able to do that. I think dental is an important part of the healthcare function. It doesn't seem to be a lot of money. And so if we can say, let's do dental for Alliance and for Healthy DC, why can't we say that?
One thing. There's one thing that is often overlooked, and it's easy to overlook. One thing that the federal government did when they passed the last, the beautiful bill, I hate using that phrase, they eliminated all federal subsidies for persons who are lawfully present,
Yeah.
but not yet have not been in the country for at least 5 years. That increases the number of people who used to be in the exchange, who now don't have a subsidy. And so there are folks out there that the count is about 121, but it's growing because people are trying to enroll every day, that are not figured in our current calculations, that are sitting on the exchange but don't have health care. So if we want to provide these benefits to achieve true parity, we're going to have to cover that population as well, and we haven't figured them in the cost yet. I talked to Mila yesterday, and like she told me the number is now 121, but she expects it to grow. These are people who used to have coverage.
Yeah.
Federal government paid for their coverage with a subsidy, and now they don't because the subsidies are gone. They would come back to Alliance, but there's a moratorium on Alliance enrollment, so they're kind of stuck. So if we deal with this benefit issue, we need to deal with that issue as well, and that's going to cost more money.
Okay. I don't want to take up too much time, but I'm just saying that if we aren't going to resolve this till June, then we're really not going to really be making a decision that actually can help people today who thought that this might be something that was coming. My other question in terms of the child care subsidy, City Administrator, when we talked about this, I'd asked the question of if we had tried to shake every possible tree of funding sources that were available when it comes to child care. And I'd asked the question about WIOA funds, knowing that WIOA funds can be used for child care. Now, I've unbraided this a little bit in terms of some of that is tied to TANF, and I know that we spend more local dollars on TANF than we do on federal dollars on TANF, but when do we have that larger conversation around how we can spend more of the federal dollars on what is available so that the local dollars can be freed up to do other things?
I mean, that's an extensive part of our formulation right now, is looking at federal dollars and money that's within the TANF program that can be put to the highest, best use. And so we're sort of looking at our different options as we do formulation right now.
I do think we recommended some changes around TANF last year in the budget. I don't think you accepted them. So we can revisit that, but we did recommend some changes around TANF last year.
Thank you, Councilmember Henderson. Councilmember Bonds.
Thank you very much, Mayor and team, for getting us on board early. My questions are regarding overtime, also the parent stipend program, and then the health care needs in-home wages. And my question is, let's start with overtime. When we talk about overtime, are we speaking of across the board in government, or are we speaking of certain agencies that tend to use overtime generously?
Our overtime working group covered all the agencies that have meaningful overtime. So the most significant users are going to be police, fire, and corrections. However, the working group included other agencies such as behavioral health, such as DPW, that have overtime expenses that consistently would exceed what we budgeted for. So it probably touched, if not every committee here, virtually every committee here.
And if I could add, council member, we asked the council to address some programs that impact the availability of our staff. And I think the legislation was included in my BSA. I think we introduced it separately because you asked for it to be introduced separately. It will be in my BSA again because the council has failed to act. But we need to change that. We have to change that to have a meaning, and I'm talking about the paid family leave program specifically, that is different for DC government than it is for the program at large. And I think for the most part, and I'll go back and I'm happy to sit down with you on this. we try to get them more in line, which we think will allow directors to have staff available more of the time and have less money spent on overtime.
All right, so that's pretty much what overtime is about, paid family leave.
It's a big part of it, and we can go, we have had a detailed review of what happens in cases where, if we don't have a corrections official available, that person has to be replaced. If we don't have a police officer available, that person has to be replaced. And frequently, they're replaced with overtime.
All right, during my recent hearing about, I'll say overtime, really about the personnel in general, are we at 48,000 employees, or are we at 37,000 employees total?
I believe as of yesterday, we were at 37,600 employees within the PeopleSoft system.
All right, and that includes those that are in the independent agencies like the water.
No, it would not include water. It would include independent agencies that are all part of the district payroll, but water would not be included in that.
Okay, so so water is not included?
No.
All right. Is that the only agency not included when we count 37,000?
What would not be included that you might think of is there are seasonal workers who may not be on payroll right now, but in the summertime might be on payroll. So 37,600 is what the most recent payroll draw was.
37,600 excludes Events DC, excludes UDC, excludes DC Water, which
Correct.
is a regional agency.
Correct.
Charter
Yes.
schools?
Charter schools.
Yeah,
They're
this
not-
is,
Yes.
I'm asking this question because when the Department of Human Resources was before me the other day, they pointed out that there were these organizations that were not included in the 37,000. So I did a quick calculation and said, so we're now talking, 47,000. That is the breadth of our government. And I kind of got, well, I guess so, because it's 37,000 plus these other individuals. I think they included UDC. So I was very curious, so I thought it would come to the head to find out just what our real numbers are. And so when we talk about overtime, we're speaking of overtime just with those that are under the mayor's authority. So, okay.
Yes. The 37,600 includes
Yes.
everyone under district payroll, even those who are not under the mayor's authority.
All right.
But the overtime working group focused on agencies that aren't under the mayor's authority.
All right. And so these other agencies, did they receive a DC government paycheck?
No.
Okay. That too was not clearly understood in the hearing, so I thought I would try to clear that up. So
Can somebody correct me if I'm wrong? I don't think
DC
that
Water
they.
gets a different paycheck.
Yes. They get a different pay. UDC also.
different paycheck.
Different paycheck.
That's my understanding.
Yes.
All right. Okay.
All
All right.
The only one I'm scratching my head over a little bit is UDC, but I'm almost certain they get a different paycheck.
All right. Thank you very much for that. And for the parent stipend program,
All very good paychecks, by the way. But
Yes,
yes,
I'm
not
aware.
signed by the treasurer.
I am aware, and I'm aware also that we have very little control over if any, of the hiring, and the only time we seem to get involved is when they exit the system. So I was very curious about that and what that really means. And I'm delighted to have an opportunity to talk with you more about
I would
paid
love
family
it, and
leave.
as well as like a citywide telework policy.
Yes, well, we do have some agencies that they're independent. I think the Attorney General is independent, and I believe his employees work maybe one day every 2 weeks in the office. And how much do we pay for that? And how much do we pay for, Mr. Chairman, you don't have your turn. how much do we pay for the lease of that? I'm being honest. Listen, we're talking our budget, we're talking about difficult times, and we're talking about what are we going to do about it. Now, my colleague was savvy to put on the table, let's talk about waste. Let's talk about duplication. I'm not suggesting that, but I am saying everything is on the table. And so let's be honest about it. If we're not using space, beautiful space, and we are leasing it, and we know we're not going to use it because we are independent, then let's accept that and let's reduce the cost, because this is a very difficult time for our community. And it's not just about us. It's about the people, the taxpayers' dollars that go into this. I can go into the discussion about, and I know my time is way over, but go into the discussion about, well, I don't know if we want to go there, but the cost of the fair elections program. We, I think, are budgeted for about $20 million. Already the estimate, and of course this was before the last 3 people came on board to pick up petitions, but it's $48 million. $48 million. These are the things that we have to wrestle with as a community. $48 million is the estimate of what it's going to cost us. And that was, that was really last month, so I don't know what it is today.
I'm sorry, Councilmember, I wasn't aware of that number. That will be something we have to make sure is funded. I will just throw out that one of the things that I think that we can address from a policy perspective is what happens with the public funds if a person fails to qualify for the ballot or drops out. I think that is ridiculous. And I think we should all, as a person who supports fair elections, I do think that we can't have, I personally have a hard time accepting people taking public dollars and then dropping out 2 weeks later.
Well, thank you. I have taken more than generous amount of time, and I do apologize to my colleagues and to the audience. Councilmember Parker, my council member, and I will therefore yield the mic back.
I want to make just a quick clarification. A little friend told me the $37,600 does include UDC, does not include DC Water. It does include UDC.
Thank you. Thank you.
Councilmember Parker.
Thank you all for your presentation. I had a few questions about the child care subsidy. How many families are we projecting will be impacted by the proposed changes?
So there are 7,360 families that are currently enrolled. Those families will remain enrolled if we were to institute a wait list. The children would naturally evolve off because of age or because the parents move them, but the families that are currently enrolled will not be impacted by the wait list.
Just new families wouldn't be able to join?
That's correct.
And then I note that the proposed changes yield about $12.6 million, yet the gap is double that.
Yes.
Can you speak to how we're planning to close the remainder of the gap?
We would have to take it from other programs.
Okay. And then related, as I'm looking on slide, 16, and the projected payments, I note this goes through October of 25. The budgeted amount has routinely been under what we know we're paying. And so that yields, to me, one of the financial pressures that is presented to us is that we're consistently under budgeting what we know the program costs. Is that fair? And it seems like there's still a pretty wide gap. And so if we know the changes that we're making won't close the gap, aren't we still under budgeting what the program will cost? Well, therefore setting up a financial
Yes,
pressure.
the changes that we are proposing will enable us to better control cost moving forward. But as you've indicated, they will not close the gap that we have right now. If we don't institute a wait list, then the enrollment could continue to grow, and that would make it impossible for us to actually budget at the cost of the program, because we won't know what the cost of the program will be.
No, and while it gives me a little heartburn to make some of these changes, which would mean more families won't be able to participate, I get it. My concern is about what we're budgeting.
I think we can, go ahead.
Oh, I'm sorry, Mayor. Councilmember, if I could just add. So if you look at the chart here, you can see actually that the budget in many years was over what the expected payments were. This was an effect of the pandemic, right? We did see a lot of students, and police superintendent, correct me if I'm wrong, not utilize childcare. And so as a result, we had more funding than we needed to make payments. At the same time, OSSI was able to utilize like federal funding or carryover local non-lapsing funding to make up the gap. But then you see we had this really big jump from one fiscal year to the next, where we just really saw both an enrollment change and a change in the designation of the number of facilities that were high quality, and that just jumped the payments way up. So we've been spending this fiscal year, last fiscal year, and now this upcoming fiscal year, trying to figure out what is the correct budget. So in addition to the programmatic changes, there will need to be budget adjustments to be more in line with where we expect payments to be.
Okay. I'll leave it there for the sake of now. Thank you.
Thank you, Councilmember Parker. Councilmember Robert White.
Thank you, Chairman. Thank you, Mayor, and your team. So the child care subsidy program has become popular. It's ballooned. That's a good thing because that many studies have shown is going to increase high school graduation rates, reduce reliance on social services, increase wages over time, help stabilize our economy, and restrictions will very likely have an impact on the stability of our child care sector, which will have an impact on our population. It is expensive to be a parent in D.C. And on the Alliance side, reductions will likely have some impact on emergency room visits, pressures on other programs we fund and nonprofits that we fund. All that to say, none of these things are going to happen in a bubble, and I think we agree on that. I take it from an earlier question that the CFO has limitations on how he can calculate these impacts from a budget calculation perspective. But as policymakers, we certainly have to look at these issues and say, what is the benefit or financial detriment to the city over time, and how are we accounting for that? So how do we, as policymakers, map this out so that we have maximum confidence in what will happen to the city and to our finances over time from the changes that we make, so we can make a more holistic analysis?
Well, from the Alliance perspective, what you are asking is really beyond our purview. Because even if we acknowledge that a percentage reduction in Alliance spending will increase emergency room rates by X, therefore we don't want to go forward with the reduction, the CFO is going to make us pay for it. So we have to have the money. So we can make the argument, and it is a credible argument, but at the end of the day, they're going to ask for the money. And so unless we have the dollars, we have to acknowledge that there could be some counterproductive effects, but we need the money to pay for the benefit.
That's a fair response, but this knowledge will help us make better decisions. So these aren't the places you've highlighted, which are critical to analyze, are not the only possible places we can make cuts. We're going to have to do some things that are uncomfortable, but we have to make the best possible decisions, and all the best possible decisions aren't determined by how the CFO calculates. He has to calculate a certain way, but we have to analyze differently, so we make the cuts in the most strategic places.
No, I don't disagree. The challenge that the mayor faces and this city administrator and the budget director faces, HHS is a very important function of government, and everybody acknowledges that, but it's also very expensive. And if they try to basically hold any cuts, hold HHS harmless for any cuts that have to be implemented to balance the budget, you'd have to wipe out some agencies to get to balance, because we account for up to 35% of the local fund budget. You can't get to a balanced budget when you have these kind of deficits without visiting HHS, which is unfortunate, but it's true.
Or schools. Or schools.
But, right, so, but that statement wouldn't be true, for instance, of the child care subsidy. It is a significant cost, but fixing it wouldn't wipe out an agency. So I still have the same question about whether we can get an analysis of the impacts, pros and cons that you see.
Councilmember, I mean, I think you're right to say, can we, fill the $32 million hole? Yes, we can, but we would have to take it from someplace else. And my likely proposal would come from someplace in one of Wayne's programs. But it just would. So the same question you asked me about childcare, it would impact something else that you care about, that we all care about. So we can fill it, and we likely will fill it, but it's coming from somewhere.
Right. I mean, it's a conversation about trade-offs.
Yes, of
right?
course.
Yeah.
All budgets are.
And when the budget comes to the council, it will be helpful. The better we understand the trade-offs, the more aligned we can be on outcomes. There's going to be, no surprise to anybody in this room, pressure to address the child care subsidy or alliance or what have you. And if we can say, hey, we've looked at what the sort of secondary impacts will be, and this is the best we can do, as opposed to just saying it's a big number, so we've got to cut it. I think that information would help us.
I couldn't agree more, but it is, and as we started this conversation, it's kind of bigger than if we're going to fill $32 million. The real question is we're starting from $700 million less than we are in right now. So that's, those are the real, just one off here and one off there won't change that. And I think that's what I think we all agree to focus on. How do we address that?
The second thing I'm excited to hear some of my colleagues talk about identifying and addressing inefficiencies. And my hope, and I know I spoke a lot about this last year, is that we can do this in a systematic way across the board, because not our government, any government is going to have inefficiencies, and this is a time of very constrained resources. We're going to have to justify a lot of cuts, and better off for the budget decisions next year and 2 years from now if we can go through that process together now, do those hard analyses across government so that we are more stable in the future and have to make fewer cuts. Last thing is on slide 3, the $1.1 billion in time limited resources. There's a significant gap for this year versus next year of $286 million. Why so many more time limited resources? What's that significant increase in time limited resources that exists this fiscal year but won't next fiscal year?
That just shows the limited nature of the fund balance that we had to move forward. We had to make sure in last year's budget that we came to within structural balance during the financial plan. So we knew during the 4 years we had to get to the point where we were spending approximately equal to the revenues we were bringing in. So we knew we had to wean ourselves off of fund balance, and it shows sort of the depreciation of that fund balance. The other element, and this is sort of part of what we all think about when we do the budget, is The top-line revenue we balance against is not fixed in stone. It's an estimate. We can beat estimates. We can grow the economy. Clearly, this was the availability of resources was impacted by the impacts of the tax cuts that were in the federal bill that's before the Congress now. Certainly going before that, the effect of the DOGE cuts. Each of those two alone, if you were to combine the two, you don't fill up that entire gap, but you get the majority of the way there. You probably get to the point, if you combine the effect of the DOGE cuts on our long-term revenue forecast and the diluting effect of tax cuts on what was a robust September economic growth, those two combined for probably $600+ million in lost revenue we otherwise would have gotten had DOGE not happened, had we had the full benefit of all the September revenue estimates. So there is an element that's an important one, which is not just the cost side, which is how do we get the top line to be as high as it can be.
I guess I'm misunderstanding what time-limited resources mean. Your explanation sounded to me, and I could be wrong, like revenue decreases, but I read...
It's one-time funding. But HPTF, for instance, has been one-time funding. So that would be time-limited.
Oh.
Councilmember, if I could add, it's a lot of that is what we refer to as year-end surplus from prior fiscal years. So when we began coming out of COVID, I think it was FY20, we had filled up our reserves, and then there was year-end surplus money that's kind of one-time in nature, but it happened several years in a row. If you also look back, some of the ARPA monies that could be used for local revenue replacement would count that. So we're just reaching the end of the availability of those resources. We no longer have big year-end surpluses that we can use to carry forward expenditures.
So what that means, if I may, is that 26 and 27 budgets spend more than the current revenues, a little bit in 28 than we expect. The actual revenue in the door is less than the expenditures, even with these dramatic implications that are being described here. And we're paying the bills by the fact that over the years we built a surplus that was uncommitted to anything else. And we are allocating those dollars to be used one time, and once they're spent, primarily in this year. Of the 1.7 that's left of that amount, most of it is spent this year.
Okay.
So,
and you can find a representation of all of these funds that we've set aside for future budgets in the financial plan, in the budget books. There's the financial plan. It's in Chapter 2, and then opposite it is just an independent chart that shows all of the excess funds that we have reserved for future budgets over the years, where they're coming from, and what years they're budgeted to be spent.
Thank you.
Councilmember Lewis-George.
Thank you, Mayor and team. Councilmember Parker asked and answered most of my questions. I don't know if he was looking over at my page or not. Just kidding. So I really only have one question, which is, what is our plan to meet our current obligation to the subsidy program? I think all the changes suggested are, I think, about containing costs from growing further, but not about sort of how we're going to pay for the existing enrollment to keep families stable and child care operators. So what can we communicate now about our plan to meet the current obligation of the subsidy program?
The changes that we've recommended right now would save us about $8 million. It would be 2 quarters instead of 3 quarters, so not quite the 12, but 8. Beyond that, though, I think that we are still looking for how we will support the rest of the year.
But the plan is to support the rest of the year.
Yeah, your question is where are we going to fill the gap?
Or is it your intention to at least support for the rest of the year?
My intention is there will be some change at some portion of the year that won't affect current enrollees, current children.
Okay.
It could affect some the 3 things that we outline here that would affect how we work with providers.
Okay.
Families in jeopardy.
Right, would some families be put in jeopardy as a result of that?
Not families that are enrolled, that are currently enrolled.
Not families currently enrolled, but then there would
Right.
probably be some.
And
not
I should
currently
say, we list these as proposals, but I haven't made any decisions about how to move forward because obviously this is impossible to, but it's a necessary discussion.
Understood. And what would be the current implications for childcare operators if we cut their reimbursement rates?
So, Mayor, I'm sorry.
Please, go ahead.
So if we were to provide reimbursement rates at a single level, then about 200 providers would take cuts of 2 to 8%.
That could be devastating. Okay, thank you.
And if the providers have thin margins, then it hurts them.
Then it hurts them, right.
And could impact families.
Thank you.
Councilmember Crawford.
Thank you, Mayor, and to your team. We've been hearing over the past few years that revenue is not keeping up with spending, and a colleague recently reminded me that when we end up in these places where we're facing spending pressures, we have to make policy choices. And so I would just add my voice and echo what I heard earlier from Councilmember Nadeau about making sure that Mr. City Administrator, as we move into the budget and council eventually receiving the budget, you keep us apprised of options that we may have in other clusters outside of human services and public education. So I just wanted to reiterate that. I was planning to ask about whether we have spent any of the items, for the items on the contingency list, but what I've heard, and I just want to name this for the benefit of constituents that have been emailing us, advocates as well. The CFO had determined that the money is available. He authorized spending for the contingency list. And what I heard today is there may be an interest by maybe 1 or 2 members or more of the council in looking back at that list and seeing if we made the right decision on the 11 items. And you, Madam Mayor, may also be recommending that we consider the order of the list. Do you want to speak to that?
Yes. I would recommend that you reconsider the list at this stage. I would.
Okay. I think we'll have to have follow-up conversations because I also heard this conversation when we passed the decoupling legislation. So I just want to name that. Finally, my last question is just on your growth agenda.
Yes.
I know last year that was a big part of the budget announcement. I don't know if there's any early indications on whether you've seen success or numbers moving in the first 5 months of the fiscal year, but obviously we have to think about revenue and what that looks for us across the financial plan. So I just wanted to hear your thoughts on the first few years of the fiscal year.
Well, I think it would be
First few
difficult
months.
for me to talk about the growth agenda because it didn't, most of it didn't move. But some things moved, and our numbers are up, right? So we have more revenue than was expected, so that's a good thing. The financial officer will remind us that it had nothing to do with us per se, other than, some very high wealth individuals did better and other people of means did better. So therefore we have more money, and so we still have to be focused on the fundamentals of our economy. How'd I do, Glenn?
Yes.
I did okay? Okay. I mean, I think that's what the CFO would say. Having said that, I do think we have to make a lot of policy choices, and we should. And I would ask the council to reconsider the posture that policy changes that are related to how we grow our economy should be separate from the budget discussion. I hope you would do that. And we will advance, what do I mean by that? What I mean is it was said that we're not going to do this as part of the BSA. She has to introduce it separately. Okay, that's one way to do it, although I've been around here long enough to know that a lot of policies get made in the Budget Support Act. And I would just ask you not to have that as a blanket policy, that we will still advance some big and sometimes piddling policy changes. And I'm going to do so with the benefit of 11 years of having been here and the real desire I have to fix some things that I think need fixing. So you can do with it what you like, but we will advance it, and I hope that you will use the opportunity in the budget to fix it.
Well, that kind of stimulates me to say something. When we had the Budget Support Act before us, there were, I'm going to say 50, 60 subtitles. I went through the subtitles with all the members, and some we were comfortable with, most we were comfortable with, some we were completely uncomfortable with, and some we said really requires more attention. So the subtitle that came up earlier, which has to do with the paid family leave for district government workers, I had hoped that that would move a little bit more quickly, but it was not something that we had the time to deal with as part of the Budget Support Act. And the reason why I'm mentioning that here is that there may be some policy changes that would help the budget that you want to recommend, Mayor, and maybe they need to be introduced before the Budget Support Act rather than as part of our 56-day consideration, because it's really hard for us to take issues like the paid family leave, which is complicated, and I'll just share, and I think this was actually at a public meeting of the council members, that some members said we really need to move forward with that because it will reduce overtime, and other members were like saying, well, wait a minute, this really has, how is this going to be treating workers, and there's some implications here, and there's some details we need to look at, and the best way to deal with that is separate from the 56 days we have to deal with the budget. So the point I want to make is there may be some policy changes that would be good in terms of the budget, and this one in particular was not scored, that would do better if they were introduced before so that we have time to deal with it rather than as part of the budget. It's not casting judgment on the proposals. It's just saying that as a matter of process.
I'm just saying if it were me, and some of the, well, I'll leave that out. But if I were you, I would deal with it sooner rather than later when it's been packaged and everybody can say, look, she did it. Just hear me out. I'm just telling you.
Well, you know,
It'll be better. It'll be better.
The council
They're not dealing with it at all.
The council
Phil.
just doesn't want to be pointing fingers saying, look, she did it.
Yeah, right.
But
anyway,
hear me now and
I say
listen
all
to me
that
later.
To say, I am happy to have that conversation. If we could do it, it would be right, because now we're 2 months out, so we did it before, it'd be right before. We did it right after the budget in last year, and we still need some of the items moved. So we want to work with you. We want to, you know, many of the things that we suggest are not at all controversial. But it is, I just invite you, my point, Phil was saying that I hope you don't have a blanket policy that says she has to introduce this separately, because that just hasn't been the case in all the years I've been here. Thank you.
We love working with you.
Thank you.
If there's nothing else from our end, and
That's all we have.
all right.
Oh.
One quick follow-up question. And Mr. Lee, if you could speak to the status of the contingency list, since that did come up.
We authorize that the resources are available. As far as I know, the appropriations have been increased. That's our responsibility, increased in those areas. It's up to the dialogue that you have to have with the mayor's office to know
So,
what's.
Madam Mayor, I would ask if you could speak to.
Yes, we haven't authorized any spending at this stage.
Can you elaborate?
Yes, I mean, that's what we've been talking about for the last 2 hours.
Well, I know we talked about the Alliance program.
Yeah.
But there were other things on the list.
Councilmember, I'll be happy to translate for you after the meeting.
Okay,
You don't need to translate for me.
It's the law. And we voted on it. The CFO made the funding available.
The translation is, I haven't authorized the spending, and Councilmember Crawford just asked if members of the council would be willing to consider the list. I didn't hear anybody say no.
So are we hearing that if we reconsider the list, or we should reconsider the list, and then there may be movement in expenses? expenditures.
I think that would be prudent, council member. I mean, I'm not saying, oh, okay. I just think it would be prudent. And if,
Yeah, we know what the law is.
$5 million for childcare subsidy, we just sat through a presentation that said the $5 million for childcare subsidy would be a drop in the bucket.
Again, we can debate the semantics, but it's the law. And so what we're suggesting is
So we know we follow the law.
we're going to pick and choose when we are going to follow the law.
no, I'm not picking and choosing when I'm going to follow the law. I will follow the law. What I'm saying is the law doesn't say do it tomorrow, and the law doesn't preclude me from coming to the council and say, maybe we should do something differently.
Okay.
And that's why we're here, I thought, but maybe I'm wrong.
So Chairman, does that mean what are your next steps as a result of that? Meaning if some of us want to reconsider the list so that some things will be funded, if, as Councilman Anderson just noted, that the $5 million is a drop in the box, or we want.
It might be helpful if, we can't do it today and it's noon. I didn't realize it was so late. Maybe we have an administrative meeting and we talk about this.
Okay. Next steps is an administrative meeting.
We're supposed to keep Tuesday mornings open. I have no idea what next Tuesday looks like. I think we have committee of the whole. So maybe before then we can meet.
Understood. Thank you. Here we go.
Madam Mayor, thank you very much.
Thank you, Bill. Thank you, council members.
How are you?
Well, thank you, sir. How are you?